All right, everyone. Big time welcome. Thank you so much. This is Roswell Park's very first Ask the Experts webinar. I'm Rebecca Vogt. I'm the Media Relations Specialist at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Again, thank you so much to the number of people that are tuning in today. We very much appreciate it. Now, we know that so many cancer patients have questions during the COVID-19 pandemic, and we will be bringing you this free webinar series every Friday to cover a variety of topics and also feature a variety of experts. We do hope that this webinar eases your fears and also showcases the many options and guidelines for patients during this time. Now, today we are kicking off with a very important topic, and that is how to safely continue your cancer care during COVID-19. I am joined by two very wonderful Roswell Park experts, and I will give them each a moment to give a brief introductions of themselves. I'm going to start with Dr. Eunice Wang. She is the Chief of Leukemia Service and Professor of Oncology in the Department of Medicine. Dr. Wang, thank you so much for joining us.
Hi, thank you so much. I really appreciate the opportunity to be here today and to speak to all of those cancer patients who are kind of have a double whammy now, COVID and cancer. What is going to be the priority? My role is I am the chief of the leukemia service here. We take care of individuals with a number of acute leukemias and other blood cancers, and I serve as a professor of oncology at the Cancer Institute and also at the UB School of Medicine.
Fantastic. Thank you so much, Dr. Wang. And we are also fortunate to be joined by Dr. John Kane. He is the Chair of Surgical Oncology and the Chief of the Melanoma Sarcoma Service. Dr. Kane, welcome.
Oh, thank you for having me. I would just echo what Eunice said, that this is a very difficult time for us to take care of patients with cancer. I'm in charge of surgical oncology, which is the breast cancer service, melanoma, sarcoma, all of the GI cancers, pancreas, liver resections, but all of the chairs within surgery have been working very closely over the last couple of weeks to develop lots of algorithms to see new patients, get them in, get their surgery done safely, and get them home, hoping to minimize their risk of getting any exposure to COVID.
Yeah, absolutely, Dr. Kane. Thank you so much for that. And I agree. I mean, honestly, as the COVID-19 pandemic it really has truly changed how much we do so much of everything these days. I mean, we're talking about the physical distancing, how we go to the grocery store, you name it, everything, like all the rules have been changed. And we're hearing from patients who are afraid to leave their homes and come to Roswell Park for treatment. And we know that there's a lot of uncertainties in this world right now, but what we can tell you absolutely for certain is that the center is taking all precautions necessary to reduce the spread of the virus. And that includes a couple of things. We're talking about reducing the number of employees and visitors who are both on campus and at our satellite locations. We are sending home staff who were at high risk. We are aggressively disinfecting all surfaces, and a big shout out to our environmental services team for doing a lot of that. And then also limiting entry to clinical buildings. There's only a specific amount of entrances that individuals can access Roswell from. But even after all of that, we still know that there's going to be questions that are out there. And of course, we are all here to answer them. Now, we do have several pre-submitted questions, but you can also access the chat feature that's down below there. It's a little chat bubble if you want to submit your own throughout the next 30 minutes. Now, that being said, we will get started if everyone is ready to go. Now, one of the first questions I think we want to get out there is, do I have to continue with my cancer treatment, and what treatments can be safely delayed? And I'll have either one of you start with that and kick us off.
Hi, so I'm going to take a first shot at that question. So the most important person to have that conversation with is really your medical oncologist. Certainly in this time of COVID, our cancer patients, many of which are on active chemotherapy, are at higher risk to develop COVID because of their suppressed immune system and their ongoing therapy. However, it's not 100% that you will be infected with the COVID, but it is 100% that if you have cancer, that cancer does need to be treated and solved. We, at this point, have no idea how much longer this is going to last. We could have be in this situation. We could have this type of isolation and quarantine situation for couple weeks, months, even extending into the summer. So whether it's safe to delay your cancer therapy over that time period is really a decision that you and your medical oncologist need to make. For example, for patients that are just getting maintenance therapy, who don't need to come in, who are already in remission, certainly the discussion would be whether it's worth it to continue that or not, or how much benefit that's having. For patients that are newly diagnosed, and in my service, I take care of a number of patients with acute leukemia. That's a very aggressive malignancy, and it's not possible in many of my patients for them to safely hold chemotherapy for a month, 2 months, 3 months. So for those patients, we are advocating that you still come in to have your cancer chemotherapy treatment, to see your doctor, to have that discussion. We are still, as was mentioned, we're still open for business. Those patients that can safely be delayed or that can safely be seen virtually, we are offering telemedicine consultations for those patients to have those discussions. I would encourage patients to reach out to your clinic or your clinical center, have a discussion, have a talk with your medical oncologist, and if they feel that you would benefit from continuing with your therapy in terms of not having your cancer progress, I would go ahead and come in. As we know, we are taking a number of precautions. We're masking everybody. We've reduced the volumes to the absolute minimum to allow us to continue to provide the safest cancer therapy despite the COVID pandemic.
I think from a surgical standpoint, the actual approach has been evolving as we started to go through this pandemic. So if you think back a couple weeks ago, there were concerns that hospitals would be full of patients that were infected. If you look at a lot of the other countries, one of the main groups of people that also gets infected are healthcare workers. And you can imagine if you're a surgeon and you're in an operating room with multiple patients, or a patient coming through the OR will touch 30, 40 different care providers. And so initially we took a very precautionary approach, really went down to emergency surgeries to kind of get things in place where it would be safe. We didn't want patients infecting the healthcare team. We didn't want the healthcare team infecting the patients either. With a lot of solid tumors, if you're having surgery, that's often your potentially curative treatment, you know, that for early breast cancers, early GI cancers. So there's a little bit of wiggle room to wait for surgery, and for some, a few weeks, some not so much. What we've learned since then has really changed. So all of the OR staff now have full personal protective equipment. So now we can operate on somebody whether they're COVID positive or COVID negative with minimal risk to the team. That's also going to protect the patients. All of the people that they're coming in contact with in the OR are completely protected. Just this week, Roswell has started to test all of the patients that are going to have surgery and be admitted preoperatively for their COVID status. And the reason that we're doing that is if there could be a little bit of a delay, say a week or two, it would be very good not to operate on somebody who's just turned COVID positive. If they started having respiratory problems 2 or 3 days after a big operation, you can imagine that wouldn't be good. So before we had COVID, if you came in for surgery and you had the flu, it wasn't safe to put you to sleep. If we could, we would wait a couple weeks. This way, we're testing every person. They're doing drive-by testing the morning before. They don't have to get out of their car. They get swabbed. We have the results by the end of the day because all the testing's done in-house. So number one, that gives us the opportunity to delay the surgery if it's not truly urgent, give the patient the best chance of recovery. The other thing is we know where to put them post-operatively. We don't want to be mixing COVID positive with COVID negative patients. So the hospital is actually triaged out to COVID positive, COVID negative floor. So we're a cancer center. We have to treat cancer. It doesn't go away in a pandemic, just like heart disease and heart attacks don't go away and trauma doesn't go away, but we want to do it safely for all the patients. So if you're COVID positive and you need cancer surgery, we'll do it, but we need to make sure we put you somewhere where it's best for you and for the other patients. If you're COVID negative after your surgery, we're going to put you on a floor where we know that the other patients are COVID negative. So that's going to give all the surgical patients the best chance to recover quickly and get home.
Just realized I was muted. Apologies. One thing I do want to actually throw in there, we do have a comment coming through of the please address the follow-up appointments. I mean, how necessary are they and for whom?
So I think that that's, again, a case-to-case basis. Many of the patients that are survivors or in long-term follow-up who are not necessarily getting active chemotherapy, I think that it may be possible for you to have a discussion, a virtual visit with your provider. We are sending patients to local labs. We are continuing to do some lab work for our patients just to ensure that while you're sitting there quarantined in your house, you're not, obviously the high level anxiety, is my cancer coming back? Do I have a recurrence? When can I see my doctor? We are encouraging patients, particularly those with blood cancers, to come in and continue to get blood work either here or locally, and for them to ideally have a virtual visit with us to determine if there's any symptoms or findings or concerns that you're having. And I think in this time, I think a lot of our patients are concerned. We are taking, as Dr. Kane mentioned, precautions. All the staff are masked. All the patients are being provided with a cloth mask. We are restricting access to only the essential visitors for our outpatient visits. So if you're comfortable coming in and having that done, we're happy to do that. If you want to come by and just get lab work done or get lab work done closer to home and set up a virtual visit, we're happy to talk to you. We're happy to address concerns, to help you get through this time. We are scheduling out patients about 2 or 3 months for a regular follow-up appointment after we have a virtual visit, just to ensure that you're not falling off the map. And we are following up with every single patient and kind of triaging them and saying, you're fine. Do you want to do a virtual visit? Do you want to do lab work? We haven't forgotten about you. We just are trying to restrict or reduce the number of on-site visitors, both for your safety and the safety of our staff and other patients.
Fantastic. Thank you, Dr. Wang. Can we kind of shift over to chemo? I mean, how long can someone wait to start chemo? I mean, like, can we wait a month? Or how would you like to address sort of the chemo situation if someone needs chemotherapy?
If I would say, again, I would advocate you having a discussion with your primary oncologist. But if you have cancer and you cannot wait sometimes to delay the chemo, and as we said, you need to potentially get treatment. You can't wait potentially 2, 4, 6, 8 weeks. Now, we can delay things. We can dose reduce. We can switch to regimens that are less suppressive of your immune system to decrease the potential that you have to get the COVID. But I think that discussion, can you safely wait, is a discussion that should be individualized. And for many of our patients, they can't. And for those patients, that's why we've made so many efforts to continue to function. We have staff, nurses, clinicians, workers coming in on a daily basis to ensure that those cancer patients getting chemo continue to get chemo despite the COVID pandemic. I think that is essential that we not compromise somebody's care because they're isolated and quarantined, and then when this is over, have them come back to our facility with progressive cancer.
Perfect. Thank you. Moving right along. So my doctor wants me to see a surgeon due to a suspicion of cancer. I'm feeling anxious and I don't know what to do. Are Roswell surgeons accepting new patients?
Absolutely. But I think anytime something bad happens in the world, there's sometimes some good consequences. So I think that this idea of social distancing and the pandemic is going to change how we take care of healthcare. And I think one of the big things is going to be virtual visits. I also think it's very important, as a regional cancer center and a national cancer center, not all our patients come from Western New York. We have patients coming from Binghamton and Albany and Watertown. We have patients coming from other states that may or may not be under quarantine, and even other countries. And so the traditional model was you had to come in, we had to see you, poke and prod you, ask you questions. But for a lot of cancers, that initial visit, a lot of the information comes from the questions, and a lot of the information may come from scans and biopsies and blood work that you've already had. And so we've really started to rethink getting people in for their first visit. So for example, I'm seeing a sarcoma patient later today virtually, and I have all of the person's scans loaded into packs. I've already looked at them. I've looked at all the records, and we're going to make a treatment plan with them never leaving Syracuse. And so what I would say is we're providing patients with options at this point. If you want a second opinion, if you're newly diagnosed, but you're caring for someone at home that may be sick, or you are just very concerned, maybe you have bad lung function or you're immunocompromised, we're looking, and as long as we can give you a reasonable evaluation and it doesn't require touching you or a physical exam, we're doing a lot of these virtually. Same with follow-ups. That was one of the other questions. From the surgical side, if you have a post-op visit and you have a drain, we haven't trusted patients to pull those out themselves yet. We do have them come in, but I have had some of my patients or their family members take out their sutures if they're otherwise doing well, to save them a visit. They can send us a picture how their incision's healing. And I would say for follow-up, it's really based on risk. You know, we have patients that we may follow for 10 years, but we know when they're 5 or 6 years out, and we're only seeing them once a year, their risk of their cancer coming back is very low. So we can put that visit off 2 or 3 months. If somebody just had their surgery 3 months ago, and this is their first cancer visit for their follow-up, then we may not be able to do that. But we're being very thoughtful about it. We're doing it really what is best for the patient, what is safest for the patient, and then whatever we need to do to make that happen safely, we're doing it.
Fantastic. Thank you, Dr. Kane. Now we've talked about chemo, we've talked about surgery. We are seeing a question about radiation. I mean, is it safe to delay radiation therapy if it hasn't started yet?
I think it depends, again, on the situation. So there are, for example, we may give insurance radiation, what we call adjuvant, after the tumor has been removed. That can often wait several weeks. In fact, we would typically wait until the person was better from their operation before we started it. And if they had some postoperative recovery issues, that would delay it. If we're giving it first, before we're doing surgery, there's a little bit of a window, but you really don't want the tumor to keep growing. So for some more aggressive tumors, having the patient get started in a timely manner would be very important. I think at all levels, what we've all been trying to do at Roswell is, you know, some of our other missions are research and education. You know, we want to cure cancer and teach the next generation and understand it better. But we also realize that often has a big army or a big team. And so what we've been doing now is the least number of providers that touch the patient. So when I saw 2 new patients this morning, it was just me. I didn't have a resident or a fellow go in first. I didn't have an APP go in first. It was just me. They saw 1 nurse. We're having non-essential staff stay home. So again, going into radiation, even though you have to come in every day, they have it set up where you're not contacting very many other care providers or patients. They're staggering the appointments so you're not sitting in the waiting room with 20 other people. They're cleaning the rooms. They're allowing extra time to clean the radiation machines and the CAT scanners and things like that. So this has really been thought out that if you need cancer treatment, it's still going to be as safe as possible with the minimum number of people that touch you.
Now, touching upon sort of that safe aspect and talking about minimal amount of people, et cetera, there is a question coming in about, you know, can a caregiver accompany a patient for a follow-up visit?
So I think at the current time, because of the number of asymptomatic individuals that we have in the community, and to try to reduce the numbers of patients coming in, we are discouraging significant numbers of visitors accompanying patients. Now that is with a lot of caveats. Certainly for a new patient visit, you need somebody to be there to listen to the plan. Some of our patients need drivers to accompany them, or they need help with a wheelchair or a walker. Certain patients may have some neurological issues that require a caregiver. So certainly we make exceptions. We do at this point, however, discourage, and part of that social distancing is to not have a family of 5 kind of coming in for that appointment. How are we dealing with that? We certainly know that you want people to be with you. We are actively using technology to call or FaceTime or to reach out, to have video chats, to include the family members in the care of the patients. Our inpatients are being provided with electronic means to video chat with their loved ones. We are providing iPads for that. We certainly don't want that isolation to be a source of anxiety, but we also need to be aware that many of our patients are uncomfortable coming to the cancer center. And they're especially uncomfortable if they leave. I've had patients tell me the only time they leave the house is to come for their cancer follow-up appointments or to get chemotherapy. And so when they come here and they see a large crowd of people, or they don't want to see a large crowd of people in the lobby, and so we just need to be cognizant of that. We are encouraging, if possible, to try to minimize those crowds of people. If you can get your blood work or your scans and you feel safe going to facilities closer to your own house, to minimize travel time, minimize exposure time, to do that, and to follow up with your Roswell caregivers here.
Yeah, that does. Oh, sorry. Go ahead, Dr. Kane.
We've taken a similar approach with surgery. Also, I would say that if you're newly diagnosed with cancer and you're just coming in for that initial visit, I think it's very difficult to be by yourself, even having emotional support from friends and family. So the 2 new patients, for example, I saw this morning face to face, they each brought 1 caregiver with them. That is a little difficult. Other people can listen in, things like that. I would say for follow-up visits, if you're established, we've been asking if you have somebody, have them wait outside. Again, we're trying to protect all the patients, not just, that particular person, and we don't want to fill the waiting rooms. I think probably the thing that has been a little bit difficult is for the post-op patients, they really have on the floors not allowed visitors. And so, as surgeons, we keep weird hours anyways. We round at 6 in the morning and 9 at night. So we're kind of unfortunately used to missing some of the patient families and caregivers. So we're used to trying to call them later in the day and give updates. But I think that part has probably been one of the negatives, but it's really in the best interest also. If you just had a major abdominal surgery and your friends want to come visit you and they're asymptomatic carriers of COVID, and then you develop a symptomatic respiratory infection, it could be the difference of not making it out of the hospital or going to the ICU for a prolonged stay. So we really have been, that's the only one for social distancing, I think it's had a little bit of a negative impact on the patients, is that immediate post-op recovery.
Absolutely. Just to circle back a little bit, I know Dr. Wayne had talked a little bit about like blood work and such. So there is a question that came through. Is it safe for me to go to Quest for blood work if I have a low white blood count and am on a chemo pill?
I would say, obviously, I can't guarantee your local Quest what type of facilities and precautions they are taking. But in many cases, if you're on a chemo pill and you have a low blood count, you need your blood counts monitored. You need to make sure that your counts are not falling to a dangerous level. You may need a transfusion. Certainly, if you are on a chemo pill and you're being monitored for side effects and toxicities, it's very important that you continue to go and get that blood work. And that, again, is a phone call or a text or a message to your oncologist. If your local lab can do that safely and you want to save yourself a visit here and we can safely get the results, I think that would be fine. We also have our phlebotomy services are open here. Again, everybody is being screened coming into the facility. Everybody is wearing a mask. All the healthcare workers, including the phlebotomists, are all wearing masks. So if you want to stop in and just get a quick blood work and then do a virtual visit, I think that would also be true. But it's important not to delay or not to get chemotherapy because of COVID, because when this is over, what we don't want to see is we don't want to see our patients having had less than the standard of care therapy. We have put aside our research protocols or educational missions to focus on continuing to provide the absolute best cancer care to our patients in this pandemic.
Okay. Now, go ahead.
Rebecca, I would say I saw actually another question popped up, which I think is along similar lines, is the person had a follow-up visit with a CAT scan, and they were asking, does it need to be done at Roswell or can it be done somewhere else? And I would say we've taken a very measured approach with that. Our radiologists here are phenomenal. They are looking at cancer studies all the time. We have state-of-the-art imaging equipment. We do have some things like a PET CT that many other places don't. And I can say on the surgical side, what we've often done is we try to coordinate, since as surgeons, we look at scans all the time. That's how we plan the operation. We'll often coordinate that CAT scan visit with their follow-up visit. They might get the scan at 10 and see us at 11:30, saves them having to come back and forth because we're going to look at it ourselves anyways. For the local patients, we're still having them come get their CAT scan here, even if we're doing a virtual visit. But it doesn't make sense for a patient in Oswego to drive here for a CAT scan, go home, and then have a virtual visit. So what we've done in that situation is we have liberalized it. We're often saying, what would be the local facility that you would go to? They're getting their CAT scan there. It's taking a day or two for it to get loaded into packs. We're looking at it, and then we're giving them a virtual follow-up having seen that CAT scan. So yes, we're being very mindful. If the patient didn't have to really come here anyways, we're trying to do whatever we can out in the community, especially if they live further away, and then doing as much as we can virtually after that.
Fantastic. One we are seeing pop through is it has to deal with, of course, immunocompromised patients. Now, will the immunocompromised patient population have to wait for a vaccine to come through, a COVID-19 vaccine, in order to break quarantine? And I know that the vaccine production is something that can take a while. We don't, there's a lot of unknowns out there, but I just kind of want to pose that out to you guys.
Well, so first of all, I'd like to emphasize that Roswell Park is a dedicated freestanding cancer center. So we do not have an emergency room. However, we are dedicated to provide care for our cancer patients. We are still seeing cancer patients. We are still, if you have symptoms and you are discuss them with your patients, we are testing patients that are symptomatic prior to chemotherapy to ensure, much like with the surgical procedures, anybody that has symptoms consistent with COVID, we are able to test them here if they're currently getting cancer chemotherapy. We are also developing, and it is a high priority, to develop a potential antibody test to determine those patients who may have been asymptomatic and had the infection at some point but now have recovered. In terms of vaccine therapy, we are farther out from that. The concern with vaccines is that they work by stimulating your immune system to recognize and destroy any infections coming into your body. We do think that patients that are immunosuppressed from their cancer therapy are probably not the best candidates for vaccine therapy. We have been doing, actually prior to this, we were doing studies in our leukemia patients to determine if they developed responses to the flu vaccine. With sort of a similar approach. So we're not 100% sure whether immunosuppressed cancer patients would be able to generate the same type of immune response to a vaccine. We have a protocol that has been opened where we are looking for patients who have diagnosed COVID positive but have recovered. And there is a protocol where we are going to be able to collect plasma from patients who've recovered from their COVID infections to potentially use that to treat COVID positive patients who are actively sick. So many things are pending. The landscape is changing on a daily basis. I would stay tuned, and I think this webinar is a great forum to keep up with what we're doing for COVID and how we're managing COVID in the setting of cancer therapy.
Excellent. You mentioned antibodies, and here's a very interesting question that came in. It says that, I'm a cancer patient and have antibodies in my blood. Are these the same antibodies that, experts talk about when they're referring to people who have had coronavirus?
No, you develop antibodies are your body's ways to defend itself from many different things. So you can develop antibodies against numerous things, including your own blood cells. Patients have autoimmune disorder. The antibodies that you have are different. What happens is when you're exposed to a virus infection, your immune system is activated to identify and eliminate that immune infection. As a consequence, once you've been infected, your body then has the ability to say, I was infected, I was able to get rid of that infection, but now that I've seen that infection, if that infection tries to come in again and attack me, I am primed against it happening, and the next time I'm not going to get as sick. Those antibodies are part of that immune army that gets generated in response to an infection, and those lay in wait for the next exposure. So those are highly specific to each individual infection that you get.
Fantastic. Time does seem to be flying, so I do want to open the floor up one more time, both to you, Dr. Wang and Dr. Kane. Do you have any closing thoughts you guys would like to get out there? There's been a lot of fantastic questions asked today and answered, but again, the floor is yours if you want to add something very quickly to our viewers.
Well, I would say that, I would echo the original comments. Our primary job is to take care of people with cancer, and whether we're doing social distancing, we're fully quarantined, we do months of mitigation, people are still going to get cancer. And so we're here. We've been here over 120 years. We've come up with strategies and pathways to minimize that person's risk for being exposed or exposing somebody else. Again, we care about all of our cancer patients, and we do worry that half the patients if you have COVID, you could be an asymptomatic carrier and things like that. We do test staff that have any symptoms or any potential exposure. I can speak for our surgeons. When they're not in clinic or in the OR, we're having them work from home. So almost think of it like a professional sports team. You want some people in backup in case the starting quarterback gets hurt. So we're very thoughtful about doing that. We have not been testing outpatients because we're using universal PPE in the OR, and the patient's going to go home. So we're not worried about them where we have to put them in the hospital postoperatively. If resources improve and we've got endless numbers of swabs and things like that, we'll probably end up testing everybody. But our job is, if you have a new cancer, if you're actively on cancer treatment, or you're in your follow-up phase and you're doing well, we're trying to come up with ways that we can still give you the best possible care, but minimize your chances of potentially being exposed to COVID.
All right, so I think that I would emphasize again, Roswell Park has been a beacon of cancer care in Western upstate New York for centuries, decades. We're continuing that mission now. We have been dedicated to cancer care for all of our patients, and we will continue to provide that cancer care in the face of many odds, including the COVID pandemic. We are now taking precautions. All of our medical staff are masked. We are screening every single person that comes to our institute. We are providing cloth masks to our patients that need to come in. We've taken every precaution to ensure that we will be able to continue to provide cancer care to our patients during this time. In addition, we have taken the expertise that we have in research and clinical trials, and we have turned that to fighting as best to our abilities the COVID epidemic. So we are opening clinical trials. Our labs are working full-time to develop the latest tests to diagnose and treat and test our patients. And we're doing everything we can. We have reduced our staff, and we have emergency plans. Should the surge come, we have contingency plans so that we will continue to provide the same quality of care to all of the patients in this region. So I just want to reassure everybody in this time of high anxiety, self-isolation, and quarantine that we're still open for business. We're still providing it, and we will continue to provide care even given the difficulties of a global pandemic.
Fantastic. Wonderfully said, Dr. Wang. Thank you so much. Innovation continues no matter what at Roswell Park. And I want to say thank you to you, and all of you who are tuning in today, and to the lovely thank you notes that we are seeing in the chat as well. We are all working through this together. Now, if any of your questions weren't answered, we do encourage you to reach out to your primary clinic and care team, and then also tune into these webinars. They're not stopping. Every Friday, right around this time, please tune back in. We have a variety of topics, even more topics and questions addressed. Now, we also consistently update our COVID-19 page on our website that has additional FAQs and more. If you want to check that out, that is roswellpark.org/coronavirus. Lots of things answered on there, and we consistently update it. Now, the video from today will also be able to view on demand in case any of your friends were not able to tune in. You'll be able to share that with them. A link will be sent to your email. We do encourage you to stay tuned to roswellpark.org/patients webinars, with plural patients webinars, and to your email to register for any upcoming webinars, which again will be offered every Friday. So have a wonderful day, a wonderful weekend, stay safe, and thank you all again for tuning in. We'll see you next time. Bye.
Bye. Take care. Stay safe.
Healthy.